Alright, so it is Monday night. Just got back from the hospital a little bit ago, and it is the second week of my internal medicine rotation. So last week I had a bit of an orientation, and then I was on the admission team. So basically we were responsible for any admissions that came in through the ER and needed to be put under one of the other medicine teams. So if we were called by the ER, we would have to go do a pretty comprehensive history, talk to the ER docs, see what they came in for, what tests they had already done. We also responded to any codes or rapids, so sort of emergencies in the hospital, help stabilize patients who were already there. And then there was also a lot of academic time. Every day from 10 to 12, we had protected academic time, so we would attend lectures by residents or attendings, or just get to study a little bit. So that setup was pretty awesome. I think it was a really good team to start on, but this week is gonna be a little different. So last week, we would admit a new patient to one of the actual medicine teams. So I am on one of those teams this week, which is Team C. So this is a more traditional team where, you have a list of 15, 20, 25 patients. You have a team of an attending, some PGY3s, and then a bunch of interns. So everyone sort of has the patients that they're responsible for. Interns are following 5 or 6 patients, and then the PGY3s are kind of responsible for everyone along with the attending. And these are patients who are in the hospital for multiple days. We're, following, checking up on them every day, coming up with a plan during rounds. So the sort of the traditional internal medicine workflow. So the way it worked was this morning at 7, I went in for sign out, which is where a resident who is covering overnight tells the day team any overnight events. Oh, this patient became hypoxic, this patient had a run of AFib, so sort of getting the important updates for the patients that we're going to be following that day. Sort of helps to guide which patients we have to watch, which ones are more stable. And then after sign out, we would go and see our patients. Some of the interns would see a few patients before sign out as well, just to sort of get the ball rolling, but I wasn't even assigned a patient yet. So during sign out, I was just kind of listening for any patients that sounded interesting. And then one of the PGY3s was like, all right, choose a patient, go see him. So that's what we did after sign out. First, I read up on the patient. He had been there for a few days already. So read the initial ER note, the admission note, and then all of the supplement notes or consult notes that had happened over the past few days. Then went and actually saw the patient, asked him a few questions. How was he doing today? Did a little physical exam, and then came back and prepped a presentation. Rounds, I think, started at 9 or 9:30, so I had an hour to do that. So really not that bad when you're only following one patient, but it did take a while to go through all of the notes and kind of really understand what this patient came in for and what has happened since he's been here. So after that, there was rounds. Rounds were pretty quick, mostly because the attendings switch every Tuesday. So this one attending had already been here for a week and had seen all these patients, so he really had a good grasp on all of their stories and what sort of the plan was. So it was really just quick updates. So the presentation today really wasn't that bad. However, tomorrow, Tuesday, we're going to be getting a new attending. So the interns and residents had said that everyone is gonna get a full formal presentation tomorrow, because this new attending has to sort of get up to speed on all of the patients on the team. So rounds tomorrow are definitely gonna be a little bit more intense and a lot longer probably. After rounds, there wasn't too much to do from a student's perspective. I went back and saw my patient once, but other than that, I just kind of studied. Every day from 12 to 1, there's what we call noon conference. So it's either a lecture or a journal club. So I went to that. But yeah, that was pretty much my whole day. I stayed at the hospital until 5:30. We had a virtual lecture on EKGs from 4 to 5:30. So I just stayed there and did it in the library, and then went to the gym, and here I am. Alright, so it is Tuesday. I just got back from the hospital, and I got to see a very cool procedure today. Yesterday, my first day of this week, I was assigned a patient who came in last week with sort of sudden onset shortness of breath. Other than that, pretty much nothing. Didn't have a fever, wasn't a clear lobar pneumonia or anything like that. Did a CT that revealed bilateral ground glass opacities. And if you're a medical student, those are some buzzwords that usually point to some sort of atypical pneumonia not your classic like right lower lobe consolidation or anything like that. It was just pretty much the whole lungs just looked a little screwed up. So we instantly got pulmonology and infectious disease involved because we knew that we weren't dealing with something very routine or typical. Both of those services did a bunch of tests. ID tested for Legionella, Mycoplasma, like all of these sort of atypical bacteria that can cause pulmonary disease. Everything has come back negative. So pulmonology was like, all right, we should probably just do a bronchoscopy to have the best chance of figuring out what's going on as fast as possible. And Monday, it was already kind of scheduled that this patient was going to be getting a bronch today, Tuesday, and my PGY3 was like, hey, you should see if you can go to it, which honestly, I had no idea was even really an option. I'm not with the pulmonary team this week. It was my first day meeting that resident, meeting anyone. So the fact that he said that, I was like, oh, yeah, I mean, I would love to. Like I said, I was pretty surprised. But so this morning I messaged the pulmonology fellow, who is very nice, and he was like, yep, sure, come by. I'll let you know when the patient gets here and when we're about to start. Around like 2:30 today, I went down to the endoscopy suite and I was able to see the bronch. It was really nice. I was able to say hi to my patient right before he was wheeled back. But yeah, so it was such a cool procedure. I've never seen anything like that before. I have seen some like arthroscopic orthopedic surgery, so I sort of get the idea of using a camera to look inside small places and, do stuff about it, but I thought it was so cool that they put this tiny little camera into the patient's lungs. Like, the fact that I was seeing the inside of the trachea, of all the bronchioles, it was just so cool and so special, and something that I was not expecting to see this week. So the procedure took about an hour. First thing that they did was just kind of look around. Everything looked normal and healthy on the inside. Then they wanted to do some lymph node biopsies, which I thought was probably the coolest part of the procedure. So they switched out the camera and made it like a special one that had a camera and an ultrasound probe on it. So basically the screen had two sides. One of it was the camera part, and then the other side was an ultrasound. So basically they used the camera part to go around. They knew exactly what part of the lung they're in, which is such a skill. I was like, yeah, these just all look like different tunnels. Like, it all looks the same to me, but they're like, oh, nope, we're in the carina, we're in the left hilum. Like, they knew exactly where they were. So basically with the camera, they navigated to part of the lungs where there should be lymph nodes around. Then they would look at the ultrasound side, sort of go around and find a lymph node, and if it was over a certain size, I forget what it was, then they would thread a tiny little needle through and take biopsies of the lymph node, which was just so crazy. Yeah, they basically, for lack of better terms, stabbed the lymph node a bunch of times with this needle to make sure that they got a good sample. And then there was actually a cytology person right there in the room where as soon as they got the sample, they put it on a slide, and then he went and looked at it under a microscope to tell us what it was. So just so cool. Like, it would be really helpful to know exactly like, oh, this is cancerous tissue, or this is normal, or that's just blood. Like, having that utility and like sort of real-time feedback, I think, is just so nice. I think the lymph nodes were completely fine. So then the third part of the procedure was they went back to just the normal camera, and they were actually going to take biopsies of the lung tissue itself. They had this little like grabber thing. One of the fellows showed me after, and it was like the tip of it was probably the size of like a tip of a ballpoint pen, but it was like little forceps, like little teeth. So they once again used the cameras to sort of navigate to the right area. Then this thing with the little teeth was on this really long wire. They threaded it all the way down through until basically they hit the end of the lungs, the little tiny like ends of the terminal bronchioles. And then they took biopsies. I think they took like 5 or 6. So yeah, that was also just so crazy. I mean, the fact that we can biopsy the inside of someone's lungs is just incredible. So far nothing has really come back yet. You know, biopsies like that are probably going to take a while. Like, I don't even know if we have the proper technology in the hospital to sort of process those and look at them. Sometimes with special stains or techniques, like, you have to send them out to other places in the country to have that done. So I don't know. Hopefully we'll know like within the week what is really going on. But yeah, all in all, like, super cool day, super cool procedure. Thank God that my resident was nice and was just like, yeah, just go to it. Like, we were on walking rounds. We had been doing it for like an hour, and I was like, hey, like, the fellow just texted me, they're about to start. He's like, oh, go, like, I'll cover for you. So yeah, shout out to him, because that was just such a cool experience, and just so nice that on my second day of this team, being able to see something like that. Alright, so it is Saturday, and a lot of exciting things have happened in the past few days. So Wednesday, we were able to discharge that patient that I was following and whose bronchoscopy I went to. After almost a week in the hospital, he was finally starting to feel better, less short of breath, not coughing as much, be on room air when his O2 sat wasn't dropping, so it was great to see him go home. So don't really have a total idea of what is going on. We had to wait on the rest of the tests from the bronchoscopy to come back, but just really great to see him doing better. And I know that he really wanted to go home, so he was thrilled. Started following a few other patients that day. One came in for like chest pain, dizziness, all that kind of stuff. So by Wednesday, I was following 3 patients. You know, Monday started with 1, then Tuesday was with 2, and then sort of Wednesday, Thursday, Friday, I was following 3 patients all those days. So things definitely picked up. I think 3 to 4 patients is probably a good number to live at. You know, the interns follow like 5 or 6, but I think from the student perspective, doing more than 4 would be sort of a lot to handle. 3 was kind of the sweet spot, not too much, not too little. I wasn't really bored at all during the day, but I also wasn't super overwhelmed. Also, Wednesday night, we had a emergency medicine lecture about sort of approach to shortness of breath, so that was great. A lot of great information about how start narrowing down the causes of shortness of breath when someone comes into the ER, remembering all the don't miss stuff like a PE or a heart attack. The only bad thing is that lecture was very late, didn't get done until 7:30, but that's okay. Then Thursday was a lot of the same, just the same old workflow of going to see patients, going to sign out, presenting on rounds, all that kind of stuff. So nothing too crazy happened then. But yesterday, Friday, was the really exciting day. So as I mentioned, on Wednesday, a patient came in with sort of this long history of shortness of breath, some chest pain, just feeling dizzy on exertion. Like, got to the point to where he felt like he couldn't even walk across the room without feeling unsteady and maybe falling. So he was sort of worked up by his outpatient cardiologist. He got a calcium score of his heart, which came back really high. So that cardiologist was a little bit concerned, wanted him to go to the hospital. So I saw him Wednesday, sort of got the story, talked to the admitting resident to sort of get an idea of what was going on, and then we consulted cardiology. Cardiology made the decision that they wanted to do a cardiac cath on him to see what was really going on and seeing if his heart was the cause of all of the symptoms he was having. So that cath was scheduled for Friday, and I asked if I could go to it. You know, after my experience with the bronchoscopy earlier in the week, I was like, you know, I might as well ask. Like, this is a teaching hospital. If the cardiologist is cool, maybe he'll let me watch. So I reached out to him and he was like, yep, sure, no problem, you can come along. So it was scheduled for 3:30 yesterday. Probably didn't start until like 4:30, but yeah, I watched that patient's cardiac catheterization. Probably the coolest procedure I've ever seen. You know, surgery is obviously amazing, and that bronchoscopy was so cool too, but you know, just the fact that they're able to put a little wire in your wrist and get all the way into your heart, and then do certain interventions, see how occluded different vessels are, and then put a stent in. Like, I just think it's like science fiction. So yeah, really, really cool. I was able to do that. And you know, aside from the learning opportunities that I got from going to the bronchoscopy and the cardiac catheterization, I really think that the patient benefited from it too, because as the medicine team, we're the ones who see them the most, go around the most. There's always the student, the intern, maybe one of the PGY3s, and the attending that see them every single day. When there's a consulted service like pulmonology or cardiology, you might see them once a day. And then especially when there's some sort of intervention that needs to happen, you're wheeled off to this other part of the hospital. And especially if you've never had anything done like that before, it can be a pretty stressful situation. So being able to see both the bronch patient and the cath patient before the procedure, said, hey, like, I'm gonna be in there with you. I was able to see them after. I think it really just put them at ease, to just see sort of a more familiar face. The cardiac cath patient was very funny. He was telling the doctor when we were about to do the procedure, like, oh, you know, you can let the student do it. I trust him. You know, this can be his first one. Funny because, you know, if I were to become an interventional cardiologist, I'm like a decade away from doing a procedure like that. But yeah, I think it just goes to show that, like, you can develop a pretty close, trusting relationship with these patients as a student, just because you have so much more time to spend with them. Like, the attending and the residents, they're so busy, they're following so many patients, they're lucky if they see a patient once a day. But as a student, you can go there 3, 4, 5 times a day just to check up on them. Oh, how are you doing? Can I get you anything? I think it really goes a long way for these patients. And I think the fact that I was able to be with them in their procedures made them feel a lot more comfortable about putting their life in the pulmonologist or cardiologist's hands. So the cath patient needed to stay overnight, so I went in this morning just to check on him, see how he was doing, talk to his wife, all that stuff. He's feeling good. He still needs to be monitored for a few days to make sure everything is okay, but he went home today, so that's awesome. You know, it's a little bit bittersweet when you develop a close relationship with a patient and they're going home, because I'll probably never see him again. You know, I'm only on IM for another 6 weeks, but it is really rewarding to see a patient come in through the ER, be sick, you know, kind of scared, and then see them on the other side when they're leaving feeling better, feeling more confident that we're going to be able to manage whatever their condition is a lot better. So yeah, all in all, after this week, I'm really enjoying internal medicine a lot more than I thought I would. I definitely think being able to see these procedures is a big reason for that, just because I think that I want to do something sort of procedural, surgical, interventional, and being able to see, like, how closely an internal medicine doctor works with these other subspecialists to sort of coordinate everything. And I was so grateful for the pulmonologist and the interventional cardiologist for letting me go observe these procedures, things that I've never seen before. And I think the fact that it wasn't me watching something on a patient I've never met before, you know, I had already had a relationship with these patients. I had been following them for the whole week. So all in all, really great week. This upcoming week is going to be a little different though. We have 1 week of outpatient primary care during our internal medicine block, so I will be doing that instead. I'm only gonna be there for 3 days though, because we have OSCE on Thursday and then I have an ER shift on Fridays. But still excited to see sort of a different change of pace and probably see a lot more patients than I was in the inpatient setting. Alright, well, that is gonna do it for today's video. If you enjoyed, please be sure to leave a like below and subscribe if you want to see videos like this in the future. Thanks, and I will see you in the next one.